Hello and good afternoon. This is Kuldeep Chaudhary from Health in India. I'm joined by Dr. James and Mrs. Evelyn, who have come from the state of Imo in Nigeria. Dr. James is a renowned surgeon in Nigeria. Hello, Dr. James.
Morning.
Hi, Evelyn.
Hi.
Welcome to the Health in India studio.
Thank you.
Dr. James has been a practicing surgeon, runs a 40-bedded hospital in the state of Imo since 1977. That's almost 35 years now.
Yeah.
He's here to get treatment which was not available back in Nigeria. He's been here for the last 2 months. Now his treatment is over and he's going back to Nigeria on Tuesday. So Dr. James, may I ask you, you were treated by the team of Dr. Pandey at Artemis Health Institute. What made you select India as the option? What I understand is you have been treated in all parts of the world, including United States of America. So how did you choose India this time?
Okay, actually, I had my initial treatment in the United States in 2005, and that was what we call prior surgery, and I felt well all along, and I used to go to the United States every year since then for a checkup, and each time I went, things were okay. But last year, that was 2010, when I got there was some abnormality detected, and when it was, I couldn't wait to go through with the investigations. So I went back. Then this year, 2012, I scheduled to go back to the United States for a checkup. And the way I had a problem, and as a result, I went back to my doctor in the States and told him I wanted to get to the root of it, to know if my problem had recurred or this was just something out of the way. So we went there. After full investigation, we found that either it had recurred or there was something left behind. But all along, I didn't have any problems until, during that journey. So at the end of the investigations, he suggested that I should have radiation. And the thing was the IMRT and IGRT treatments. But such treatments are not available in Nigeria anyway. Then when there in the United States, he referred me to a radiotherapist, an oncologist. We discussed it there and then. There was no further investigation, and they said I was going to pay a certain amount of money, which I thought was outrageous, particularly because I didn't prepare from home for that kind of expenditure. So I said, okay, the best thing was I'm going to go back home and think. Now I know that some people come to India for treatment, so I went to the internet to find out where such things are done. That is the IMRT and IGRT. And I found a number of places, and I communicated with them. Now, Team in India, or Health in India, was the first one to give me an answer. And I discussed the answer with my wife and children, and we all agreed that I should make further communication in order to know what to do. So that's how we came to know your establishment, first of all. And then as we communicated all along, we started to choose to come to India through Health in India.
Okay, Dr. James, you've been here for the last 2 months, and during that period you've had more treatments, the dental treatment, even Evelyn got an arthroscopy of the knee done. How do you, and you've been in the healthcare, you've seen the healthcare the world over. Definitely now there are a large number of American patients, especially those who are uninsured, who come to India to avail the lower cost of the treatment.
Sorry.
And recently we had this patient who got a knee replacement done, and he told us the rates and prices in America are beyond the reach of anybody who is uninsured. They were asking $150,000 for a knee replacement, and he got that done for just about $8,000. Similarly, IGRT in India is available for $6,000 to $7,000, which is much below, and the equipments you have seen. So how would you rate the quality of the Indian healthcare vis-a-vis the healthcare available anywhere in the world?
Well, actually, what I've seen is with Athenis, I haven't been to other health establishments in India, and I rate it very high from the point of view of the equipment available and what treatments are really available. Because there are certain treatments that are not available in certain parts of the world because of either inadequate manpower or lack of modern equipment.
Yeah, these are very capital intensive,
yes,
they cost a lot, these
yes.
equipment.
So what I've seen has impressed me a lot, and I rate India very high. Mark you, I've been to the United States, they are also high, but they're very expensive for a person who is not insured. And I've been to Canada, I've been to Britain, but I rate India, you know, on equal footing, or even they have an edge in that they are considerate and affordable. Because if something is very good and it's not affordable, it's useless to the person who desires to have it.
And the in charge of your treatment at Artemis was Dr. Subodh Pandey.
Yes.
Any special words about Dr. Pandey? Because I have met him many times. I find him a very simple man, but very dedicated to his patients. What were your experiences?
Yeah, you said it all. Simple, unassuming, very busy. You know, you find him going all over the place when he's not seated on the computer, and he's a human being. That's important. He's a human being, and he took interest in my case, and I'm sure he does that for other patients too. And his technical crew were very sympathetic, courteous, and very caring. And in fact, they had become my friends. And so Dr. Pandey, I rate him very high. I've had a few discussions with him, and he's approachable. And I think he knows what the job is.
Okay, Dr. James, recently, one of a great Indian cricket player, Yuvraj Singh, he was diagnosed with cancer, and he went to the US to get the treatment, and now he's become brand ambassador or for survival against cancer. You yourself have fought cancer successfully for the last 16 years, I believe. What is your message going to be to anybody who is diagnosed to suffer from cancer?
Well, there are cancers of different types. There are some you can treat almost anywhere. Like if you have a small skin cancer, anybody can excise it with the wide margin and all that stuff. But there are some areas where, even though there are people who may know what to do, they don't have the facilities. But for me, in my practice, if I see any patient now with cancer, say like prostate, who needs treatment, and if that treatment is not going to be surgical, and perhaps he may require radiotherapy, because I'm talking about what I know, I'll certainly recommend him to come to India. The surgical aspect, I haven't met any of the general surgeons or urologists, but I've had contact with the onco-radiologists, and I would, because now in Nigeria we are seeing many more cases of cancer of the prostate. Unfortunately, we are seeing them late because, one, they're ignorant, two, the things are not diagnosed in time, and when they come in, they have fairly advanced cancer. And those people who may benefit from radiotherapy, when surgery alone cannot help them. I think I would recommend them, if they can afford the fare, to come.
So Dr. James, now that you have personally experienced Indian healthcare, you have seen Indian people, do you think you'll be able to guide a lot more Nigerians into getting treatment in India?
Oh, sure. If, like I said, the patients will see. I'm not going to go on the air because it's not allowed. But if people come and I see their condition, I'll suggest to them what can be done. And if it's acceptable to them, I'll certainly ask them to come here. I won't send them to where they cannot come back from. for various reasons.
No, at Health in India, we have a tie-up with almost 200 hospitals in the country. So, and we decide which hospital does what better. There are sometimes hospitals which both the hospitals are doing the same work with the same success rate. Some of them, like Artemis, are in the premier class, so their charges are high. But some of the other hospitals do have the same amount of skilled manpower and the technology, and their prices are low. So, the healthcare offers almost all kinds of solutions for people with all kinds of budgets, especially in the field of surgery, where you need the skills of a surgeon more than fancy gadgets and equipments. So, in surgery, you can get a routine GI surgery for as low as $1,500 and at some of the expensive hospitals, the same surgery would be done for $5,000 to $6,000. But at Health in India, we select the best which will suit a patient and then give them that solution.
Right.
And then we make sure that at the end of the day, you're not dealing with commodities. It is a human life.
Yes.
And what best one can do for a human life, that's the most important thing.
Right.
It was a pleasure having you over here, Dr. James and Evelyn. And you still have some hours left before your flight. So I hope you see more of India and take back good feelings.
Yes, no, the point is this, that I thank you very much for this interview and the questioning. But I cannot leave here without expressing my gratitude to Team in India. When you read things, paper, sometimes you think you're not dealing with human beings, but we are dealing with human beings here. And your team has been wonderful. From the reception at the airport, where Godi Shubham was in charge. He's been in charge all the way. And he's conducting us all over the place. And we've met many of your team members who've been very kind. And your big self.
Oh, yeah.
The chairman of the location. You've been wonderful.
Yes, sir.
And you've treated us, like I said, not just like clients, but like friends, human beings.
Yes, sir.
And we're grateful, and we hope that what we come for in the long run will be deemed successful.
It is.
No, that was the most important. Every patient who comes over here, and that hope and the happiness which they take back, that's the most important thing. Health in India was started just because we saw too many bad things happening in the medical tourism market, where people were only interested in earnings.
Yes.
Today it is not even 2% of my company's business earnings. But what it gives us is the kind of satisfaction it gives back when people come on wheelchairs with despair written all over them, and when they take back happy memories, and in the process we win lifelong friends. So it was great to have you. We wish both of you a very, very happy and healthy life.